In this segment, we're going to demonstrate a respiratory assist muscle energy technique to treat a unilateral sacral extension. And in this case, the patient would have a positive seated flexion test on the right. They would have restricted SI joint motion and our landmark palpation of our sacral sulci. On the right side, the right sacral sulcus would palpate more posteriorly or shallow, and the right ILA would palpate deep. So on the same side, we have a posterior sacral sulcus and an anterior or deep inferior lateral sacral angle. We're going to palpate the sacroiliac joint first to abduct the lower extremity and internally rotate the femur to loose pack the SI joint. And then we're going to contact with either our thenar eminence or our finger on the posterior sacral sulcus on the right. And to further enhance the therapeutic effectiveness on this technique, we could have the patient prop up into the Sphinx position, which would help begin that anterior flexion of the sacrum if it's comfortable for the patient. So if the patient's up in the Sphinx position, we have loose packed the SI joint, and then we're going to contact with either our hypothenar eminence and then reinforce. We could also just contact in this manner to reinforce, and then have that patient take a slow, deep breath in. We are resisting the sacral extension, and then when the patient exhales, we're going to engage that sacral sulcus or sacral base with a anterior force as well as a little bit of a caudad pressure, and then maintain that pressure. And then as the patient inhales, we're going to resist sacral extension, and when they exhale, we're going to exaggerate sacral flexion. And we maintain this for at least 5 to 7 respiratory cycles. After we're finished with our technique, we're going to reassess our 4 points of our landmarks to determine if they are more symmetrical, and then of course we can reassess the passive SI joint motion as well as the seated flexion test. So a unilateral sacral extension on the right using a respiratory assist muscle energy technique.